For many years, we separated the mouth from the rest of the body. That was a mistake. Now, more than ever, we need to understand the risks in the clinical practice of dentists who do not treat bruxism and which specialties should treat it. Bruxism, which I will answer for you today in this lecture, you are facing the greatest opportunity of the decade for us, dentists, which is to position ourselves regarding bruxism because it is just beginning. I know that many of you have already positioned yourselves regarding aesthetics, but those who are positioning themselves today regarding aesthetics are entering very late. So understanding bruxism is not to take you away from your specialty, it's for you to stand out in your specialty. I brought a case for you related to bruxism, but she came to me to replace the central incisor. The complaint was the central incisor, the complaint was aesthetic, but it was a case with perio, with endo. A case that could also be ortho, a prosthetic case, an aesthetic case, and a case that when making the record 360 degrees, I discovered that this patient also has pain and she has chronic headaches. And the question is, what do the masticatory muscles have to do with chronic headaches? If the patient has bruxism, before there was no test to know if they have bruxism, now there is. I will show you this during today's class. So I want to tell you that bruxism has entered the equation. Bruxism is no longer a separate entity. Bruxism will be present in the patient who asked you for a central. Bruxism will be present in the patient who came to get an implant. Bruxism will be present in the patient who needs to have a root canal. And how are we going to deal with this? Will we close our eyes and proceed with dental treatment without considering the risk this patient is facing? Why is the patient at risk? Because bruxism is an amplifier of occlusal force that shouldn't be there. So any dental treatment will be riskier for the patient who has bruxism, and this will cause long-term problems. Therefore, providing a ceramic treatment without longevity is shooting yourself in the foot. The patient will complain, the patient will express dissatisfaction, the patient will want their money back. The patient who fractures a tooth will not want to pay for the implant. They will want you to pay. So if you want to know more about these topics, start following me and share with more dentists.